The coalition of unemployed bonded diploma nurses vowed to spend another night at the Ministry of Health if they are not handed their appointment letters.
We are suffering. Our parents don't have money, but they've been able to pay our school fees. Up to now, they are still feeding us. They are fed up. The frustration alone in the house is too much for us.
Vice President Dr. Mahamadou Bawumia, during his 100 days in office, disclosed that about 11,000 nurses had been given clearance for employment.
In these last 100 days, approval has been given to employ 11,000 health trainees who graduated between 2012 and 2016.
But nurses are doubtful of the Vice President's remarks. So who are the 11,000 nurses who have been given clearance according to the Vice President? Does the number include the bonded diploma nurses? If not, what exactly is delaying their employment? And what has happened to government's promise to get the issue fixed? We'll be digging deep into the matter and get some responses from government and also do some independent analysis from some analysts from the health sector. This is today's big story. My name is Aisha Ibrahim. The nurses have been at the Ministry of Health since Monday and will not move an inch unless government heeds to their demand. According to members of the coalition, they are yet to be posted 2 years after the completion of their program. Some of them who thronged the ministry had sponges, towels, among other things, vowing not to go back home until their issue is addressed. Let's hear from some of them.
I'm not going back until I've heard something about my clearance and my postings. Because right now, this morning, he granted an interview that we are liars, we are ignorant.
Who granted an interview?
The minister, saying that we are liars, we are not bonded nurses. Besides, we are referred nurses, which is not true. We are referred nurses, all right, but we've passed our exams. We can't be here saying we are nurses whilst we are not. We can't do that. You get it? So what he is saying, he should come here and tell us, we've already told you that this is we showed you our certificates, we showed you our PIN. If we are not nurses and midwifery council will not give us PIN. We have our PIN. We have everything that shows we are nurses. So what are you telling us? You said you've granted clearance for 11,000 nurses. We fall within. So why are you preventing us from working? Or why don't you want us to work? We are suffering. Our parents don't have money, but they've been able to pay our school fees. Up to now, they are still feeding us. They are fed up. The frustration alone in the house is too much for us. We are begging him to come to our aid. And without the clearance, we are not living here. That's our plea.
So let me get from you two. You've heard all that has been said. Yes. You know that this is a process. It's not a one-day event. Why don't you be a bit more patient if you've waited for this 2 years? This is a new government that has just taken office. Why don't you be patient to allow them to fully enroll you onto the system by rather agitation?
You see, sometimes it's very disheartening, right? My problem is we completed 2015 February. And then that same year, 2015, November, hack, and then community nurses what? Completed. For them, right? So we'll be waiting. Maybe the minister himself will come. Whether he comes or not, he will be here.
So how do you intend moving this fight forward? It's almost been the same thing all of you are generally talking about. Yes. How do you intend to move this fight forward? You are here, no one is attending to you, and you are still insisting that you'll be here till you get something positive. Yes. Does it look like you're going to make any headway?
Yes. Yesterday in the evening around 11 p.m., the chief director, Dr. Zakaria Nafisa, came around to calm our temper down and have reassured us. But as to when that assurance will come to pass, we can't tell. And he said today we should meet her. So we'll be waiting here till 4 p.m. She said she'll be going to a meeting this morning, so she'll not be around. We'll be waiting for her until she come back and come and brief us with how far things have gone so that we know the next step we'll take. From here, if we didn't get any approval or anything, then we'll move to the Flagstaff House and register our petition to the president. That's what we want to do.
Let's do some analysis now. Robert Kujo is the Public Relations Officer at the Ministry of Health. Good evening to you. Thanks for your time on today's big story. So how does your ministry explain this, that these nurses have been hovering around for the past 2 years without employment?
For the past how many years?
2 years.
Please, it's not 2 years.
How many years?
After their service, they've been home for 9 months, please, not 2 years.
Well, that's what the nurses are telling us, that they've been home for 2 years. Okay. So how do you explain this, that they're still coming to you to look for a job, to get their clearance letters?
How do I explain it? Well, I think this is where we have got to as a nation. We all know some time past, one nurses and teachers complete their national service straight away, they're boosted. But I don't know what actually happened. Somewhere along the line, we had a backlog of trainees who were sitting at home, including these people who are vacating here at the ministry. Well, we're here yesterday. One day came and they said they've been at home for 9 months, and they let that the recruitment is ongoing and that they are not considered, so they don't know why. It took time to explain to them the attempt that we are doing or making to ensure that they are recruited as soon as possible. And that issue, the patients and give us some little time to go through the process until we issue them the appointment letters. But when we go home yesterday, we thought they had listened to us and that that ended all, not knowing they were not happy about what we told them. Only to wake up in the morning to be told that they slept here and that they are still at the ministry. So we've been engaging them throughout the day. I don't know, they seem to be a bit difficult, though they have their rights. We've explained everything to them, we've appealed to them, we've done all that we need to do. I've gone ahead to show them a letter, a clearance letter that we're waiting from the Ministry of Finance, which I believe it wouldn't take a long time to get it cleared to enable us also recruit this batch of health professionals. I even went further by showing them something what is not normally done, by showing them the list of the names of those whom we are seeking clearance for. And one some of them who are around me saw their names. I mean, they were happy and they left. We've told them everything. The government is not sitting on this. The government is not happy seeing these nurses sit at home after they are training for 9 months. What is being done to ensure that they are recruited? As I speak to you, I'm still in the office. Only a handful are still around. I mean, almost all of them are gone. You can count this about 10 here. I've spoken with them, I believe. If not because of the rains, probably they would have also left. So I think the issue is resolved now. They should only give us some time and they will recruit it.
So you say you showed them some letter, clearance letter. What does this clearance letter say? Has it got some timelines?
Yeah.
You said you showed them some letters to the effect that their issues will be resolved shortly. But what does this clearance letter say? Does it have some timeline on it?
We wrote to the Ministry of Finance seeking clearance to employ those who have been sitting at home. It's about 4,528 names. We're waiting for the clearance. One is considered. The process will begin, and then they will be appointed to the various stations. Like I said, I went further by showing them the list of names whose clearance we are seeking for. And when some of them saw their names and their institutions where they attended their schooling, they were so happy they kept quiet, and then they realized that after all.
Mr. Kujo, you recall during the 100 days in office of this government, the Vice President explained or hinted that some 11,000 nurses have been given clearance for employment. Which category of nurses are we talking about? He didn't explain that. Which category is it?
There are so many. I can't mention them. The clearance is, yes, 11,000. We we have already posted, as I speak to you, about 7,000 plus. The remaining are also being processed. But this very students who are at the moment picketing, few of them are picketing at the ministry, they have a separate clearance. So it's not a one-time thing, because the people think that the 11,000 will resolve all the hard recruitment issues. No, the 11,000 doesn't cover everybody. There are still people who are outside this 11,000. That is why we're making an attempt to make sure that we clear the backlog. That is why we're also looking at this additional 4,000 something. That is excluding the 11,000, which we have already posted 7,069. So we're only appealing to them to just exercise patience and then give us a little time. Because if the government wants to clear the backlog, people have been sitting at home for quite some time now. That is what we want to clear.
So what has the Ministry of Finance been telling you? How long will it take the Ministry of Finance to clear these people so they can have some job to do?
Well, we'll be following up. I think we've not been given any specific time, but I don't think it will be too long a time. Because, clearance, normally it takes a bit of time, but at this point, I believe it wouldn't take time because we sent it a couple of months ago. So I believe it will be released as soon as possible. And
so can you give us some timeline?
That will be very difficult for me to do. But the assurance is that these brothers and sisters who are in our home will be recruited as soon as we get the clearance from finance.
All right. We will be monitoring this event to the last minute. Many thanks for your time. Albert Kojo is Public Relations Officer at the Ministry of Health. Let's listen to Vice President Dr. Mahamudu Bawumia, who explained that some 11,000 nurses have been given clearance to start work. And the question people still ask is, if 11,000 nurses have been cleared, why are we still seeing this? Let's listen to him. We can continue with this discussion afterwards.
In the area of health, we've had a lot of trainees, nursing trainees who have been sitting at home. Within these last 100 days, approval has been given to employ 11,000 health trainees who graduated between 2012 and 2016.
This is today's big story. We can get onto the other phone line and speak with President of the Coalition of Health NGOs, Dr. Gabriel Benanko. Good evening to you, Doc. You're welcome on today's big story.
Good evening, Aisha.
Doc, we've all been worried with the current doctor-to-patient ratio, which is not encouraging. And definitely this brings to bear the importance of these nurses to offer assistance at the various health facilities. So there's no doubt we urgently need nurses. But here we are, we're not making use of them after spending money to train them. What implication will this have on our health delivery system?
Yeah, thank you. Good evening, Ghana. And certainly, what you are saying has a negative implication to the country. But let me state this. There are two major issues that government ought to have done. The first one is to look at the 2016 holistic assessment in the health sector, which give a very stagnated achievement in terms of providing health services, in terms of human resource deployment. And so that gives a very clear indication that there's the need for human resource to be redistributed and add on to the various health facilities to be able to meet the targets set by government. The second aspect is that from all indications, Ghana has produced enough nurses and other para-health workers, which we may not be able to utilize all of them. So the option is we have to go into health tourism, where we need to deploy some of our own youth health professionals, create opportunity for them to serve within the sub-region, and then Ghana can earn money on that. So these are the two strategic things that the country Ministry of Health need to strategically take a bold decision on. Then what I want to encourage Ministry of Health to do is to open up and get closer to the dialogue discussion rather than trying to behave like the previous administration, where they do not give opportunities for these unemployed health professionals. It is important that you prevent it now than to allow it to go haywire, so that the whole country will be put into another state of strike and other things. So it's a very good opportunity for Ministry of Health to begin immediately effective dialogue instead of playing that laissez-faire role now. Otherwise, it could create a lot of problems and stress the health system. And we are not able, and we will not be able to meet the 2017 target we set for ourselves in terms of human resource deployment and health service delivery in the country.
Doc, there are those who feel that bonding these nurses is sometimes what creates the confusion because if these nurses are not bonded, they could go elsewhere and look for jobs, I mean, in the private sector. How do you feel, or how do you recommend this issue is resolved?
Yeah, we can still have the option. Bonding is good, but what is the health needs, what is the human resource need of the country? It is very critical that the government of Ghana look at equity in terms of the health sector. Where do we need nurses and other medical assistants when we don't have doctors? Where do we need them? We need to take action on that. We also have to look at how can we use the current human resource within the given opportunity in these times. And then what can we do to bond people or to unbond people if we are not going to employ them? Because every parent sending a child to nursing or other medical schools is having the intention that their woes will be addressed. So if people finish school and finish their service and they are not employed, especially in the health sector, where it is assumed that everybody trained as a nurse or other health worker must automatically be employed, it gives room for all this unnecessary strike and it's not good for the country. So I think that in some cases, by the needs assessment by the Ministry of Health, we need to bond people to provide certain specialized services. In other areas, we need to allow people to go to school, do their courses, and have the opportunity to serve elsewhere, and then they can also remain something for the country.
All right, many thanks to you. Dr. Gabriel Benanko is the president of the Coalition of Health NGOs. We can go back and listen to these nurses sharing their frustrations.
I'm not going back until I've heard something about my clearance and my postings, because right now, this morning, he granted an interview that we are liars, we are ignorant.
Who granted an interview?
The minister, saying that we are liars, we are not bonded nurses, besides we are referred nurses, which is not true. We are referred nurses, all right, but we've passed our exams. We can't be here saying we are nurses whilst we are not. We can't do that. You get it? So what he is saying, he should come here and tell us, we've already told you that this is we showed you our certificates, we showed you our PIN. If we are not nurses, nurses and midwifery council will not give us PIN. We have our PIN. We have everything that shows we are nurses. So what are you telling us? You said you've granted clearance for 11,000 nurses. We fall within. So why are you preventing us from working? Or why don't you want us to work?
Joining me on the phone line once again is Ben Arthur, who is a labor consultant. Ben, you're welcome on today's Big Story. Mr. Arthur, you're on today's Big Story.
Yes, thank you for having me, and my greetings to all your cherished viewers.
All right. So we were so worried in the last 2 years when we experienced lots of these labor agitations, and we thought they were over with the change in government. Do you have any idea why we're finding ourselves here again?
For general labor agitation, I will not be able to speak to it and say that there are A and B to it, probably presently, except to say that the various ingredients keep on bringing the labor agitations are still available. And gradually, I'm sure the government is putting mechanisms in place to minimize them. When it comes to labor conflict in its entirety, cannot be erased entirely from human interactions. But how it will be managed is something that we can afford to handle. So that is the way it has to go. As far as people are not satisfied with how much they are earning and they are not okay with the conditions of service and other related matters, they will continue to agitate. But I'm also certain that the coming of the new government and the way and manner that the need to seek financial clearance from here, there has been a budget that had to be read and passed and for things to be put in place. Definitely, some section of workers might not feel patient at all. Most especially when we look at the nurses trainees who have been waiting for quite some time and had been promised earlier by the previous administration that they will be fixed. And up to now, they are still waiting to be fixed. Definitely, some temperaments will get overboard. But I'm sure the necessary steps have been taken. And very soon, I'm certain probably will not be seeing the same group of people demonstrating again.
But interestingly, we are told that some 11,000 nurses have been given employment. But here we are, a lot more nurses are asking for the employment letters from government. How does this come across to you?
For me, and for what I know and have heard, it's not employment. It's financial clearance to engage 11,000 trainees. What it means is that, in fact, when in the public sector they talk about financial clearance, even if you have had your letter of appointment or it's written for you, there's a need to do what we call an appraisal, job evaluation, negotiations, and the rest. And even when fair wages can give you your salary, and can tell you how much is due you, and your mother employer, National Health Service, and for that matter, the ministry can say that we are engaging you to do this and to do that and to do that.
But in the case of these nurses, they've not still gotten any clearance from the Ministry of Finance. Does it make it an issue that government is overwhelmed with issues of employment?
No, not to disrupt you, but for me, it becomes a bit difficult to say. Even when we say financial clearance, in my technical view, sometimes it might not have to do with specific names. It has to do with a number of people who have to be engaged. So maybe our friends should be a bit patient and see whether their names will come up or not. Once people have been engaged and you realize that your name is not in it, then definitely you have a very good case to say that the clearance did not cover you. But the clearance is for a number of them to be engaged. As of now, I am not certain anybody, not even the sector minister, can come out to say that Mr. A or Mr. B or so has been hired out of the 11. What you can say is that you intend to engage 11,000 of them. But whether they are going to be 13 female or 50 males or so, it will be difficult for me and where I am to probably be specific. So it's within their right, you know, as people who have been bonded, and I empathize with them very much. People who have been bonded and do not have a place to go, you know, have been staying at home for quite some time. It is normal to expect that some of these things will crop up. But I'm certain that even the 11,000 will not be able to cover all the people who have not gotten engagement. It's step by step, and they should keep on praying that there's.
All right, many thanks to you, Ben Arthur. That's all time will allow us. Ben Arthur is a labor consultant. So we've been talking about nurses picketing at the Ministry of Health, and they intend to sleep there one more night if their demands are not heeded to by government. But government says it's working around the clock to resolve their issues. This is today's big story. We'll still be updating you on this issue. My name is Aisha Ibrahim. Enjoy the rest of our programs.